The one particular thing that we consistently hear back from patients, whether it's a patient that's been to our office for the first time or a returning patient, is how appreciative they are of the time that we spend with them. We really do take the approach that having a patient understand all the details of their particular procedure or surgery is a really important facet of the physician and patient dynamic and makes for a really strong partnership. We want people to feel like they've come into a home type setting where they can feel comfortable and feel relaxed. And we really take that philosophy from the minute they walk in really through their post-operative visits. We want the operating room and the preoperative holding area and every person that people come into contact with to exercise that type of philosophy, that they're our guests and we're really doing our best to make people just feel comfortable. People come in with a lot of presupposition about certain procedures that they're interested in and they feel that they're a candidate for. And we're always happy to listen and be respectful about people's ideas and interests because it really guides the consult. But what we try to do is take our experience and our expertise and apply that towards their areas of interest and the procedures that they're interested in so that a plan that addresses their specific needs can be developed. It really is helpful to have two physicians under the same roof. From a professional level, there are certain nuances that occur on a regular basis whereby you might have a question or want to sort of get someone's additional opinion, and to be able to look at a colleague and ask, is this something that you're thinking the same way that I'm thinking, or would you approach it differently? You end up sort of getting really two minds for the price of one, and it ends up benefiting the patient in the long term. Price is always a touchy subject in plastic surgery, and understandably so. It's not an inexpensive endeavor. That said, I certainly think that our office is competitive and reasonable when it comes to pricing for cosmetic surgery. You don't want to necessarily choose a plastic surgeon or pick a procedure based on price alone. You want to make sure that the person who's doing the procedure has experience, that they're board certified, that they are able to achieve your desired result. And price should be reasonable. Price should be in line with what the region dictates. Our clinical coordinators are really very skilled at individualizing payment plans and dealing with people's individual financial aspects. People come in with, a physical sort of concern, and it's relatively straightforward to address that. What's great to see is really when you get a chance to hear how correcting that particular aspect or addressing some surgical concern really made a difference in some aspect of their life that they didn't anticipate. A generalized feeling of self-confidence, an improvement in neck and back pain, the ability to wear a type of clothing that they felt too self-conscious to wear beforehand, or just a feeling of general well-being and happiness with the result. And it really makes what we do worthwhile.